My good people, receive greetings from Uhai Center. My name is Edwin Gitau Kibe, and as usual, I welcome you to this learning session. Remember, we always exchange ideas, we share information so that we can try to change what is affecting our society. Sasa nataka tubonge kuhusu something that we say so casually, that we say without realizing that it has an impact, about people who are having challenges with alcoholism. In most cases, huwa unasikia msee amesema huyu jamaa akikunywa anakuaga mwenda wazimu. Huyu msee akikunywa anakuanga so unruly. But we don't realize that there is a possibility, kuna uwezekano ya kwamba huyu mtu mwenye anatumia pombe anatumia sababu ya what is going on in his head. His brain has a disorder. Say for example, his mind is racing, his thoughts are racing, and for him to calm them down, he looks for a drink, a depressant, so that at least he can manage the anxiety in him. Similarly, we have some people who are also at their lowest moment. They need something to elevate. They need something to keep them alive, to stimulate their nerves, and they use stimulants. For the people with the high end, when they are feeling so high, they look for depressant. For people who are low down there, they look for stimulants. Depressant is an example of alcohol. Stimulant is an example of coffee, tea, mogoka, and amphetamines. So, when you are having these challenges, you realize that you have an underlying mental problem. It is very mild. In most cases, it is mild. And we have mental disorders, and they are classified, and that's why we have psychiatric doctors who treat diseases of the brain. So, when you see that somebody is presenting differently, do not be quick to judge them. Do not be quick to say that they are pretending. Do not be quick to say that akilewa huwa anakuwa mwenda wazimu. There is a possibility that this person is experiencing some mental problems. And now the intersectionality of the substance use disorder and the mental disorder, we call that section the confusing diagnosis. We call it comorbidity. We call it co-occurrence disorders, and it becomes very difficult for proper diagnosis to be made because you don't know whether this person has an underlying mental condition or it is the substance abuse that is making him to behave the way he is behaving. This is the reason as to why I'm calling upon all of us, when your loved one is experiencing substance use disorders, take them to the facility. Peleka huu msee rehab. Peleka huu msee kwa psychiatric doctor. Wacha kuassume, so that when the treatment takes place, the professionals, the psychiatric doctor will work hand in hand with the addiction professional. And holistically, we are going to resolve the issue. Over and above that, you will realize that the next possible outcome of the alcoholism, drug and substance abuse, is the mental disorder. If you continue using the substances, there is a likelihood they are going to interfere with the mental faculties and you get disorders, something we call substance-induced psychosis. This is the correlation between mental health and alcohol and drug abuse. But worse still, the continued use of substances goes ahead and interferes with very vital organs in the body. You get the lungs are affected, you get the liver is affected, you get the kidneys affected. All vital organs, they are affected by the substance of choice that this person is using. You'll also find that there are those people who have polysubstance abuse. What do I mean? This person is chewing miraa, huyu msee anachoma ndom, anatumia TE, anatumia Chavis na Kuber, all these substances. And remember, each substance has a unique effect in the body. Each substance has its duration of how long it stays in the system. So if this person combines substance use disorder, mental disorder, and medical disorder, you'll find people with blood sugar problems, you'll find people with blood pressure problems, you'll find people who are having cancers or even ulcers, and all these interrelated issues is what now we call multiple disorder, comprising of mental, comprising of substance use, and medical disorders. Let's take care of our loved ones. Let's take care of ourselves. Let's not just assume things. Can we seek for professional help? Because we as professionals, we are there and we are ready. There is a lot of help that is awaiting you out there. May I take this opportunity to appreciate the treatment facilities, to appreciate the addiction professionals, to appreciate the counselors and psychologists, to appreciate the government. Of late, we are seeing a lot of improvement. Mental health is being embraced. We want also to work hand in hand with the government. We are very lucky this time round that we have political goodwill. Congratulations, Your Excellency, Madam Dorcas Gachagua. Congratulations, Your Excellency, Dr. William Samoei Ruto, and your Deputy President, Rigathi Gachagua. We really appreciate. We know you have good intentions for this nation, and especially the menace of alcoholism and drug abuse, and as well as mental health issues. And finally, to our workplaces, please usifute msee juu ati mnakunywa pombe. Usidhulumu mtu sababu akona challenge ya mental. No, this is a disease. It is a brain disease, and we can treat it, we can manage it, and we can do better than we are doing. With this awareness, I wish you well until our next meeting. My name is Edwin Getao Kibe. I welcome you to Uhai Center. We are here in Thika. We do a lot of corporate trainings. We do a lot of addiction counseling. We do a lot of mentorship and career guidance. And you are always welcome to come and get help from our offices. We are in Wetaidia House, 4th floor, room number 423 in Thika Town. Until next time, visit us at www.uhaicenter.com for more information. Thank you and God bless us.